Most people don't know what global health is. All they see are headlines about cuts in US government funding for foreign aid. Most people don't know what acronyms like PEPFAR or USAID mean or what these programs actually do. There's a narrative in the media that these programs are a waste of money. But this narrative has absolutely nothing to do with the reality. I'm going to tell you about a patient that made me understand what global health is all about. I'm a US trained physician. I started visiting other countries to treat patients with TB, HIV, and other diseases in 2001. In 2006, the organization that I worked for launched a program in Lesotho, which is a small mountainous country in southern Africa. And the first health center that we supported there was in the mountains of Lesotho. It was called Nohana. This was not the big city. And I was shocked when I arrived that the population of Nohana and the surrounding villages, a quarter of them were infected with HIV. Many of them had severe immune suppression, what we called AIDS, after obviously many years of untreated HIV infection. So every day we would see patients with advanced infectious diseases like tuberculosis, and many of those patients died. The problem was that up until this time, HIV treatment was not available in Lesotho. So like many poor countries, HIV treatment was deemed just too expensive. Of course, you could get tested for HIV, but what was the point? HIV was incurable, so if you got a positive result, it was just a death sentence. And so this was the result. HIV running rampant throughout the country, even in remote mountain villages. Now, around this time, HIV treatment for the first time became available in Lesotho. It was largely because of the launch of PEPFAR, which was a huge global health program started by the US government, started by George Bush. I don't want to get into it right now because there are other videos about PEPFAR and the Global Fund. But for us, it was a revolution. We started as many people as we could on ART, which was HIV treatment, even in remote villages like Nohana. And this was one of the first patients. Jonas, her doctor, diagnosed and treated her for TB, but at the same time noticed these purple lesions on her face. Now, it's not widely known, but with severe immune suppression, patients can develop very strange cancers. And one of those cancers is Kaposi sarcoma, or KS for short. It's linked to human herpes virus 8, which is very common. It's transmitted in saliva, often from mother to child, but it's completely harmless, except in advanced AIDS and HIV, when it can cause tumors from the cells of the lining of blood vessels. So you have tumors of leaky blood vessels, and that blood breaks down and causes that purple lesion that you can see in KS. Now, Jonas did everything right. He treated her TB, and then he started her on HIV treatment because that's what the textbooks say. If you can rebuild the immune system, then you can cause the KS to stop growing or sometimes even start to go away. But there are things that you learn in the mountains of Lesotho. And one of them is that sometimes the textbooks aren't right. When she started on HIV treatment, something mysterious happened in the interaction between her immune system and the cancer, and the KS got a lot worse. It worsened dramatically. By the time I saw her about a year later, the chaos lesions covered her face. She was living in the health center permanently, probably because it was too difficult for her family to take care of her. It was affecting her ability to see and to eat. She was still able to walk and to talk, and all of the health workers knew her. In the mornings, she left her door open and she would wave at them. But a few months later, Jonas told me that she had passed away. I tell the story first because we should remember the dead. Even a young woman who died 20 years ago in the mountains of Lesotho. Second, she is a patient that I think of when I hear people say that global health programs are a waste of money, or even worse, are neo-colonial. When I think about Lesotho 20 years ago, I think about all the patients that we started on HIV treatment. For some of them, it was too late. Their HIV was too advanced, like this young woman from Nohana. But some literally got up from their deathbeds and are still alive today. Their HIV has become a chronic medical condition to be controlled with medications. And now, after 20 years of programs like PEPFAR, Lesotho is completely different. Cases like hers with severe HIV are really rare. People get diagnosed and treated with HIV much earlier, before they develop severe immune suppression and before they get so sick. So this is the power of the US government. It's the power of global health. There are real problems in global health that we need to fix urgently, but we can't go back to the way it was 20 years ago. And above all, I never want to see a patient like that young woman in Nohana ever again. I try to explain global health and the work that we do. If this story resonated for you, please watch my other videos, and I'll see you next time.